Today I'm going to walk you through the 3 best supplements that can reduce pain, improve function, and decrease stiffness from arthritis. These natural options may help transform your quality of life. I'll also share one essential tip you should know when choosing a supplement brand. Hi everyone, many people turn to supplements because they want a more natural way to manage arthritis. The 3 I recommend most for osteoarthritis are Boswellia serrata, turmeric with curcumin, and glucosamine with chondroitin. Let's start with Boswellia serrata. This comes from the frankincense tree and has been used for centuries in Ayurvedic and traditional Chinese medicine. What makes it so effective is its strong anti-inflammatory and pain-relieving properties. In fact, it works on a similar pathway as common pain relievers like aspirin and ibuprofen. A large review of studies found that Boswellia extract can reduce pain, improve stiffness, and support better joint function compared to placebo. These results were consistent with a 2018 study that reviewed over 20 supplements. Boswellia stood out as one of the most effective. Most supplements sold today use a concentrated extract, not the raw resin. The recommended dose for arthritis is 100 to 250 milligrams once a day, ideally with your first meal. It's generally considered safe, and studies show no major differences in side effects compared to placebo. Still, supplements can sometimes interact with prescription medications, so it's smart to talk with your healthcare provider before starting. The second supplement I recommend is turmeric with curcumin. Curcumin is the active ingredient in turmeric, the spice widely used in Asian cooking. Research shows curcumin has both anti-inflammatory and antioxidant effects. A meta-analysis found that curcumin works significantly better than placebo for reducing pain, stiffness, and improving function. Even more impressive, it was shown to be just as effective as NSAIDs like ibuprofen or naproxen, without the serious risks those drugs carry, such as stomach bleeding, kidney damage, high blood pressure, and increased risk of heart attacks and strokes. Turmeric and curcumin are safe and effective, making them an excellent alternative. The typical recommended dose is 1,000 milligrams daily. The third supplement is glucosamine with chondroitin. Now, studies show that Boswellia and turmeric or curcumin usually provide stronger benefits than glucosamine and chondroitin. So if you're just starting, I suggest trying those first. But for people who want to try everything, here's what we know. Both glucosamine and chondroitin are compounds naturally found in cartilage. Some studies show they can reduce pain and improve function, especially in the knees, hips, and spine. Other studies, however, found little or no benefit compared to placebo. One possible reason is that many trials studied glucosamine or chondroitin alone, but not together. When taken as a combination, evidence shows they work better. A systematic review found that the two together significantly reduced pain, stiffness, and improved function compared to placebo. The recommended dose is 1,500 milligrams of glucosamine and 800 to 1,200 milligrams of chondroitin daily. Remember, they should be taken together for best results. Before I move on, if you've found this information useful so far, please click the like button. It really helps spread this video to more people. Thank you. To summarize, Boswellia serrata and turmeric with curcumin have the strongest evidence for reducing osteoarthritis symptoms. Glucosamine and chondroitin, when taken together, show moderate benefits. But what about other supplements you may have heard of? Vitamin D and omega-3s might help, but the effects are usually small. Type 2 collagen looks promising, but there's not enough high-quality evidence yet to recommend it over the 3 I just discussed. One very important reminder: supplements are not regulated by the FDA. Unfortunately, the industry has a history of false advertising and inaccurate labeling. A recent study found that nearly 90% of supplement labels didn't match what was actually inside the bottle, and about 12% contained at least one prohibited ingredient. Because of this, I recommend only buying supplements that are NSF certified or USP certified. These are independent organizations that test products to make sure what's on the label is actually in the bottle, and that there are no unsafe contaminants. NSF and USP certified supplements. These aren't endorsements, but they may be more reliable. Finally, keep in mind that supplements are just one part of arthritis care. They can help, but they work best alongside a comprehensive plan. There are 4 other treatments I strongly recommend because they can make an even bigger difference in your quality of life. Check out my upcoming video where I will explain what those are and how you can add them to your routine.